Hi Danny, my name is Shelby. I'll be your nurse today. How are you feeling?
Feeling okay. Recovery's going pretty well. I think we all have a lot of questions about, my life after this, but I'm glad my family's here to help and listen with me.
That's really normal for something new like this. I totally understand. We'll go over a lot of things. It's good to have extra ears to listen to it. And if you guys have any questions, just jump right in, okay? So we'll first talk about kind of how to change the bag, how to change the adhesive that's stuck to your skin, and go from there.
Awesome, good. I think that's where most of our questions are. So.
Okay. You're just going to pull back your sheets here. All right. So this bag just snaps on here. So you can just snap it right off, and then it can just go right into the garbage. And then the adhesive here, it's going to be kind of a pull. I'm sorry. There we go. So you're going to make sure you wash your hands to prevent infection. And if you have gloves at home, feel free to use those. And then you're going to take warm soapy water, and we're going to clean from the inside to the outside as good as possible. Do it as many times as you feel you need. And then make sure to dry it really, really well. That's how the adhesive sticks. And if it's still wet or if you get really sweaty, the adhesive won't stick, and that's kind of what causes a lot of leakage problems. So we'll dry it really good. And then you want to cut around this adhesive and make sure it's nice and smooth, and you don't want it too snug on the stoma, but pretty good. Okay. So put this over the stoma and then make sure it really sticks down there.
What's a stoma?
So the stoma is the inside of the colon that they kind of flip out, and that is where the stool will come out now.
And how often should she change it?
The bag and the adhesive should be changed about every 3 days. You can change the bag more often if you'd like, but not more than once a day.
Okay.
So this will just snap right in there, and you're set to go.
Okay.
So, all right, so I'm just going to show you how to empty the bag. You can either stand over the toilet or do it in a bucket, whatever is most comfortable for you. So you're just going to untake these Velcro and unravel it, and then it kind of opens up here. And we're just going to kind of squeeze the stool on down. You don't want a lot left over.
Okay. And how often can I empty the bag? Or should I?
I would empty it when it's about a third full. You don't want it too full. You don't want stool sitting around the stoma there. So when you're done emptying it here, I clean out the inside just to prevent any leakage and excess. Then I fold it once more and do another wipe. And then you can just ravel it up and it'll Velcro back onto itself.
That looks pretty easy enough.
Yeah. Any other questions you guys have?
What are some signs that you should call a doctor?
Yeah, that's great. So the stoma is fairly large after surgery. It will shrink down in the coming future. And then it's really red right now. You want it like a red or a pink color. We don't want it blue or purple. If you have a fever or cramps and pain in your abdomen, if you're constipated, if you're not getting any output, I want you to call the doctor. Sometimes gas gets filled in there. Some things to avoid are like eggs, broccoli, gassy food, and then really, really make sure you're drinking lots of water. That can help prevent the gas buildup, can help prevent leakage, and the output will be more normalized.
When will things go back to normal?
Yeah, so I would wait between 4 and 6 weeks before you really get back to extraneous exercise or a lot of bending. Really be careful of that site. But then things should be good, and you should be able to go back to normal. It's pretty easy to conceal it. So
Yeah, awesome. Are people gonna be able to smell it? Because that would be pretty embarrassing.
no, these bags are usually really good, and if you have the adhesive on there really tight and the bag is clicked in, it doesn't leak and doesn't smell, so it should be good for you.
Okay,
All
good.
Thank you.
You're welcome.
Thank you.
That was